So here's our blood gas report. And up at the top you have it at 37 degrees. Then you have a co-oximetry. Then you have the oxygen status. And you have the corrected for 39 degrees Celsius. This patient is at 39 degrees. The patient has a temperature. So this machine has corrected those blood gas values for that temperature. Let's go up one little notch and look at the oxygen status. We're looking at the PO2 divided by the FiO2, 4.55. Here, we've written this blood gas down, and as you can see, his PaO2 is 454.9, but we don't know what oxygen he's on. If you drew this blood gas, you would know what oxygen he's on. But in this case, we don't have a clue because we didn't draw it, we're just looking at the results. So it's really not good for very much. But here we have a clue. The PO2 divided by the FiO2 is the PF ratio. And here we have the ratio as 4.55. 4.55, 454.9, so we'll round that to 455. And we'll divide that by X, and that is going to equal 4.55 millimeters of mercury percent divided by 100, or percent. This is in millimeters mercury percent. If we want to get rid of that percent sign, we multiply through by 100, and we're going to get 455. 455 divided by X, that's the oxygen. Oxygen equals 455. The oxygen then is going to be 1, or 100%. So because of this, we know this patient is on 100%. That's just a little trick I told you I would mention in the future. So let's look at this blood gas. Here we have a pH of 7.30. We have a CO2 of 60. We have a PO2 of 150. And we have a bicarb of 30. Now what do we know about this? This is an acidosis. And what else? The CO2 is high, out of the normal range, so it's a respiratory acidosis. Respiratory acidosis. The bicarb is 30. That has moved out of the normal range, and it's compensating. The bicarb is high, so that's a lot of extra base, so that's compensatory. So we have a compensating respiratory acidosis. Has it moved the pH back into its normal range of 7.35 to 7.45? No, it's still acidotic. So it is only partially compensating respiratory acidosis. Now let's say your patient, you've just arrived your patient, and he's on 100% FiO2. He's on a respiratory rate of 12. He's on a tidal volume of 600 and a PEEP of 5. And let's put him with a little bit of pressure support of 12. But we are on SIMV and pressure support, and the patient is fully sedated right now. So his total respirations are 12. Total respirations are 12. So here we have a patient who's arrived from the emergency room to the ICU. We've put him on the ventilator. We've waited 15 to 30 minutes, and we've obtained a blood gas on these settings. FiO2 of 100, respiratory rate of 12, a tidal volume of 600, a PEEP of 5, and a pressure support of 12. His total respirations are 12, so he's totally sedated right now. His blood gas is 7.30, 60, 150, and bicarb is 30. We know that's a partially compensated respiratory acidosis. What do we do? What we do is we always normalize the pH. Normalize the pH, so we want to fix the pH. How can we make that pH move back toward this normal of 7.35? And this is a respiratory acidosis. So what does that mean? It means the respiratory therapist has to come in here and get rid of this CO2. Because remember, CO2 is acid. CO2 is acid. Think of carbonic acid if you want to. So CO2 is acid. We got to get rid of it. How can we get rid of some of this CO2? Well, we've got to increase his minute ventilation. Minute ventilation is a formula. Minute ventilation equals respiratory rate times tidal volume. Minute ventilation, respiratory rate times tidal volume. We've got a tidal volume of 600, and we've got a respiratory rate of 12. 12 is a normal respiration. 600 might be normal, it might be a little high, it might be a little low. At this point, we have to take a look at the patient, we have to look at the body weight, we have to look at the ideal body weight. But we're not going to do that right now. That'll be in the next video. We're going to right now say, hey, I can get rid of this by looking at his minute ventilation, which is 12 times 600 equals 7.2 liters. Now, do you see what I did there? In respiratory, we talk about cc's and milliliters. 600 cc's times the rate of 12 equals 7.2. That doesn't make any sense, does it? Well, we've converted from cc's or milliliters to liters just in one quick fell step without even mentioning it to anybody. 600 times 12 is 7.2. We moved a couple decimal points there through the magic of the metric system. So we've changed our minute ventilation into liters, and our tidal volume is in cc's. Okay, so we know we are breathing at 7.2 liters. Minute ventilation, every minute we're moving that much air. If we want to get rid of this CO2, we have to increase that number. And we can do it any way. We can raise the tidal volume, put them up to 700. Or we could raise the respiratory rate, put them up to 16. We would make those changes, and then we would repeat the blood gas to see if it has moved in the correct direction. What would you like to do here? We don't know without looking at the patient. There are some things we have to consider. So that's how we're going to fix this CO2, by moving the minute ventilation.